You're watching News Mongolia on MNB World, and I'm your host, Jargalma Tufshinjargal. On the news, Mongolia today. About 67% of all babies are born prematurely in Mongolia. Currently, around 80,000 individuals in Mongolia are not engaged in any form of employment. World Health Organization highlighted 60% of Mongolian teens have tried e-cigarettes. Regulations are needed. For the news, stay tuned. Six to 7% of all babies in Mongolia are born prematurely, a figure that has not declined in recent years. Factors such as air and environmental pollution, maternal nutrition issues, and stress all contribute to the risk of premature birth. Doctors are emphasizing the need to improve medical care and services for premature infants and to significantly reduce air and environmental pollution to ensure these babies grow up healthy. Birth before 37 weeks of pregnancy is considered preterm. Although the number of premature births in Mongolia is relatively low compared to other countries, the survival rate of these infants remains a concern. For instance, the survival rate of babies weighing less than 1,000 grams is only 27%. This ongoing issue, which has not seen improvement year over year, is influenced by various factors, including air and environmental pollution and the mother's health conditions. Air pollution reaches the baby through the placenta. This means that air pollution has a severely negative impact on the health of pregnant women and newborns. Premature babies often have underdeveloped lungs, and when lung development is insufficient, the child is at risk of oxygen deficiency and developing chronic lung diseases. Providing medical care for premature newborns in rural areas is challenging from the moment they are born, starting with transportation. Healthcare workers in Arhanga province often have to drive for many hours to transfer a premature baby from a home to the province center. To prevent the newborn from getting cold during the long journey, they wrap the baby to keep it as warm as possible and try to manage with the resources available. In developed countries, premature babies are transported in incubators to ensure their safety. There are many challenges when it comes to transporting a premature newborn and a mother who has just given birth, whether they are transported together or separately. As a developing country, Mongolia still faces limitations in providing full and accessible medical support. That's why, in many cases, we are compelled to transfer patients to the province general hospital for further care.
Remote homes are typically located about 200 to 220 kilometers from the province center. Preterm births usually occur around 3 to 4 times a year in these areas. Transportation remains a critical issue in rural regions, especially for premature and low birth weight infants who are at high risk of complications due to exposure to the cold, infections, and other health hazards during transfer.
In recent years, many countries around the world have adopted kangaroo care to improve the survival and development of premature babies. Mongolia has also begun introducing this method. The baby is placed in a special wrap and positioned upright against the mother's bare chest, allowing direct skin-to-skin contact. To ensure the baby's airway remains clear, the baby is positioned so that the mother can see the baby's face at all times. This skin-to-skin contact creates a warm, secure, and nurturing environment that is highly beneficial and comforting for the baby. Using kangaroo care helps prevent sudden infant death syndrome in premature babies. Most importantly, it protects the baby from hypothermia. This type of care is not only crucial during the neonatal period, but also plays a significant role in the child's long-term development. It positively influences the baby's cognitive and emotional growth. Kangaroo care is being practiced for only 20% of all premature babies, but there is a goal to fully implement the practice in the future. Meanwhile, doctors emphasize that improving air and environmental quality is essential to reducing the number of premature babies. With over 80,000 people in Mongolia currently unemployed, the government is ramping up efforts to guide students toward 130 identified in-demand professions, yet awareness remains low. While policies like student loans and scholarships are in place, many students are unaware of the opportunities available to them. As of 2024, this accounts for approximately 5.4% of the population. In response, the government has identified around 130 priority and in-demand professions and is implementing policies to support students pursuing these fields. Examples include the Student Development Loan Fund and the Education Loan Fund.
According to the education law, these priority and in-demand professions must be accredited by law. The second advantage is that students in these fields are eligible for 10 types of financial support from the Education Loan Fund. In other words, students studying in-demand fields can now access both student development loans and non-refundable grants. And thirdly, once these professions are officially confirmed, students can also study abroad in top global universities in these areas. This opens up new opportunities.
Although policy measures are being implemented to support training in these in-demand professions, relatively few students are aware of or are making use of these opportunities. I'm a first-year student majoring in robotics and artificial intelligence. I think there are, but I haven't received much information about it.
My knowledge about it is very limited. I haven't really come across any info. Since I started studying the major I chose, which is automation of electrical systems, I researched and found it's a highly demanded profession in Mongolia. That's why I chose it. I just heard about it now.
Similarly, other countries have also identified priority professions based on their labor market needs and are actively working to attract talent in those fields. For instance, in Germany, the private sector takes a proactive approach in training the professionals they need.
In Germany, there's been a shortage of skilled professionals in artificial intelligence and IT sectors in recent years. So industries and companies provide scholarships to students studying these professions from the very beginning and offer them the chance to gain work experience while studying.
In France, there is a significant shortage of engineers and teachers. To address this, our country has invested heavily in raising awareness among the public about these professions and attracting people to study them. Of course, they also offer scholarships to support them. Mongolia updates the list of top priority and in-demand higher education fields every 5 years. This is done in alignment with labor market demands and national development programs. However, the number of job orders has increased each year from over 50,000 in 2021 to more than 110,000 in 2024. Therefore, we aim to highlight through this report that new policies and decisions are needed to close this gap. E-cigarette use among Mongolian youth is surging, with 60% having tried them. The World Health Organization is urging regulation as aggressive marketing and weight loss fuel a growing health threat. The World Health Organization reports that approximately 60% of adolescents in Mongolia have experimented with e-cigarettes. A recent study found that within a 500-meter radius of schools in central Ulaanbaatar, there is an average of over 13 shops selling e-cigarettes. 45% of these retailers place e-cigarettes near chewing gum, and 20% display them next to sweets and other youth-oriented products. Advertising often includes discounts, enticing flavor imagery, and puff count labels, tactics shown to attract young users.
Studies have been conducted among 15 to 18 years olds, and sadly, 1 in 3 children in this age group is using e-cigarettes. These products are just as harmful as traditional tobacco. Besides nicotine, they contain various harmful chemicals.
E-cigarettes are currently not covered under Mongolia's tobacco law. They enter the country as electronic goods, avoiding tobacco taxes and selling at lower prices. This opens the door for these products to take over 1/3 of the tobacco market. If we don't take protective measures, we risk failing to safeguard our children's health. According to the World Health Organization, nicotine from e-cigarettes causes lasting harm to the developing brains of adolescents and significantly increases the risk of addiction. E-cigarettes also pose serious respiratory risks, including lung damage and inflammation. The WHO recommends strict import restrictions, limiting nicotine content, and banning the display and sale of such products near children and teens.
It is very important to understand how the market of e-cigarettes is in Mongolia, because we know that the availability and access and the exposure of adolescents will increase the propensity of the young population to take e-cigarettes. And this study that is undertaken by WHO will show what we have already suspected, that the e-cigarettes market in Mongolia is increasing explosively. And you can see from the study that in 2020, the value of e-cigarettes in the market was only about $1,000, but in 2024 it has exploded to $21 million. So it means that the e-cigarettes are very much available even to the ordinary stores, and adolescents can access them without regulations. So this study is going to show the extent to which e-cigarettes are distributed across the market and the extent to which young populations, especially adolescents, are being exposed. And this is a very important signal and a call to the government to put stringent regulations, including WHO advocating for the ban on e-cigarettes all along, because other countries and many countries in the world have selected to ban rather than to regulate, to ensure that the population are protected.
Experts warn that Mongolia's e-cigarette market is rapidly expanding, growing from $6.7 million in 2021 to over $21 million in 2024. Before 2021, e-cigarettes represented a negligible share of tobacco imports, but by 2024, they accounted for about 23%. The growing health threat highlights the need for not only regulatory oversight, but also increased awareness and vigilance from parents and caregivers. Thank you for staying with us. Here are the currency exchange rates provided by Mongol Bank. Alright, that's all for today. Thank you for staying with us. We will see you tomorrow with more news and updates. Goodbye.